about that human trafficking talk. So, but somehow I could not come in time. So, I know some of the faces here because some of them are my patients also. So, uh, the main role of my talk was, as Sister Celine was telling at the end, everybody should have heart. It's not only about the heart. It's also about every heart should have also a brain, and every brain should also have a heart. Okay, then only you get the right information and also the right way to treat patients humanly. Okay, that is most important. Okay, when Father asked me, okay, I was always contemplating on always writing a book. That is like, how does Christianity shape me as a doctor? Okay, so I'm partly writing that. So the religion has a great impact on my professional service also. So that is the reason why I accepted to come and give a talk here also. Basically, I talk more of scientific content rather than all this awareness talk. But this will be definitely useful for many of people who have crossed 40 years of age, who wants to protect their heart so that the brain is full of their heart, so that they can serve their, yeah, fine. So they can serve the society better. So be smart and protect your act. Next slide. So there are multiple awareness talks in the YouTubes and in social medias and X and everything. So all these things, who talks it? Okay, who talks about it? If you really look at it, it will only be a cardiologist or a corporate hospital person who will be talking about it. So if you ask them really, if a cardiologist says, I do not want prevent all the heart attacks here, okay, what will be my role then? I'll be jobless. Okay. So whenever somebody advises us something, we need to be very careful who advises it. Okay. So it is something like a person who's repairing a punctured tire says how to prevent a puncture. Okay, it is like that. Or a bank person says how to double your money. It is like that. So whenever a cardiologist or a person who talks about prevention, you should always ask about, if I prevent everything, okay, what is my role? Okay, I am jobless basically. Basically, world revolves on a kind of what do you call that as basically on a business platform. So they might sound a little bit philanthropic, but it is not really philanthropic. Okay, that is the reason why I want to make sure this care for the heart talk is going to be very, very practical. It is not going to be anything theoretical. So I'll start with this slide. How many ladies do you see? Okay, the answer for this I'll tell at end. So basically, when you come to heart as such, okay, there are top 10 killer diseases in the world. Okay, so initially before 10 years or 20 years back down the line, before 20 years, we always used to say somebody in our family used to have heart disease. Okay, so but now when you look at each and every family, you will have some heart patient, you will have some cancer patient, because it has become so rampant that initially we used to say it is only my grandfather or grandmother. Now it is only about even our paternal uncle, even my brother has an heart disease. So even in this crowd, we will know that there are multiple people who will have a heart disease. Okay, so this has become a top 10 global killer disease of the world. Anywhere you go, okay, there are two things. It is either cancer or heart disease. This year, if 2025, okay, heart disease kills more patients. Okay, 2026, cancer will kill more patients. So it is just the strength between both the top two places will be occupied always by either the heart disease or the cancer patient. Okay, so it is the same thing. It happens all over the world. India is no exception here. So what you see here, it is across India, it is the same. But when you look at it, why has this happened? Okay, what has changed over the last 20-25 years? Okay, if you look at this slide, you can find out. This is my granny. Okay, this granny, I took a picture from her just for showing it to people. Okay, so basically, 20 years back, she was just chewing a beetle net, but now she's sitting with a smartphone. Okay, many a times what happens is our lifestyle has changed so considerably that we have become more prone for all these sedentary diseases. That is the main reason why our heart diseases and the cancer role has got increased. Cancer may not be related to sedentary, but mainly heart disease has been it has got an important component of being sedentary in your lifestyle. That is not working much. Okay, so when it comes to even during COVID time, okay, if you look at the statistics here, you can see here, okay, during COVID time, we had 800 to in the peak of the COVID. We have 800 to 1,000 deaths in India. Okay, in Tamil Nadu, if you look at it, we will have 100 deaths in Tamil Nadu in a day. But on the other hand, if you look at heart disease, it kills 4,000 people in a day in India and 300 in Tamil Nadu in a day. So every day, 300 people in Tamil Nadu dies because of heart disease. So even during the peak COVID time, we were so panicking about so many deaths which are happening around. But every day, this amount of death is happening around in and around us. Okay, and just look at the numbers alone. So how much should we be panicking about this? Really? So, but what happened is COVID is an infection. Okay, it was a new thing. So that is the reason why we gave so much importance to it. But when you look at the statistics here, you'll find out that heart disease kills more patients than the peak COVID deaths. Okay, so when you look at heart, we need to know what really the heart is. Okay, the heart is something like we need to know how does it function. Okay, what is an heart disease, what is heart attack, or what is the symptom, what are the risk factors, and more importantly, how do you diagnose it and treat it, and the end, which is more important, is prevention. So you can ask me the questions as a cardiologist, why should I prevent the heart disease? Okay, not all heart diseases can be prevented. Okay, I am looking at patients, okay, whose diseases cannot be prevented. I would like to treat those kind of patients. I do not want to treat a 19-year-old person who comes with an heart attack. Yesterday I had a 19-year-old person who comes with a heart attack. Okay, so it doesn't out of 100 heart diseases or heart attacks, okay, 70% can be prevented. Okay, I would like to treat the 30%, okay, not the 70%. Okay, so that is the reason why when we talk about the prevention, okay, when usually not the YouTube people, okay, or the corporate people, they would want more patients to come to their hospital. Okay, that is how money spills. But on the other hand, when you look at a person who really wants to prevent heart disease, it is only about the 70% of preventable diseases which can be preventable heart diseases which can be prevented. So when you become older, okay, your blood vessels are going to get clogged with cholesterols and calcium. That can never be prevented. Okay, but on the other hand, young patients, okay, who comes with heart diseases, that can be very easily prevented by many of these preventive measures which we are going to talk now. Okay, so basically heart is nothing but a bioelectronic pumping system. So basically, if you want to define heart, it is nothing but something like a electrical current which goes inside the heart, and it stimulates. Electrical energy is converted into a mechanical energy, and the heart is going to pump blood into the various organs. That is the function of the heart. So when you look at it, heart diseases can come as in different spaces. It is like a spectrum of diseases. It is not only about the heart attack. It can be a very varied reasons. It can be pumping problem that we call as cardiomyopathy. Okay, that is the usual thing which leads to heart failure. Okay, second thing is congenital heart disease. Congenital heart disease in the sense you a kid born with a hole in the heart, or a kid born with a wrong connection in the heart. All these things are congenital heart disease. Next would be, as I told earlier, it's a bioelectronic pumping system. So it is not only the pump, it is not about the vessels or the blood vessels which supply the heart. It is also about the wire. If there is a problem with your wire or your battery, you might end up in putting a pacemaker. But most important, which most of us are scared about, is this coronary artery disease. That is the thing which leads to heart disease. So heart disease is not only about heart attack, it has multiple spectrums in it, and one of the spectrum which forms the major component in it is this coronary artery disease, which leads to heart disease. So when you look at heart attack, what really happens is, this is the heart. Heart pumps blood into the blood vessels, into the different organs. It will also have its own supply. It is like it's like a motor pump which pumps blood into a different fields, and it will also have a irrigation supply. So whenever there is something blocked in that irrigation supply, then you get this heart attack. This is a common variety which we find out in every each and every patients. Out of 100 patients with heart disease who comes to the hospital, 90-95% of them will be having this. So why is this? Why is this happening? Why is this cholesterol getting deposited? It is mainly because this cholesterol deposition is a part of aging. Very rarely our genetics are so good that even at 70 years of age, or when you do an angiogram with the patients, they will not have any block at all. Okay, but on the other hand, the cholesterol deposition starts even from your womb of your mother. So basically, it starts from the first decade, goes into fourth decade, fifth decade, and slowly with time, okay, this cholesterol deposition, calcium deposition keeps on going. It's basically like how your bones get damaged or your cartilages gets damaged. It's the same way your blood vessels also gets blocked. For some people with genetic history or with family history, people may get this coronary artery disease slightly earlier. So when you look at the symptoms, this is something which will be exaggerated in many of the social media. It is not about what happens really is hospitals will want to scare their patients, but on the other hand, patients wants to demean their or decrease their, they want to demean their symptoms. Any symptom, that is like anything from your chin to your umbilicus, any problem, any discomfort, it can be an heart disease or a heart problem. Okay, that is a dictum which we need to know. So some people what really think, what they think is that it will be just a gastric acidity, but you should not take it in a first sense like that. Usually patients will always say they ate something non-vegetarian or something like that, and they will always say that it is because of the acidity I am feeling a little bit discomfort. But it is not like always like that. Okay, but on the hospital side, all they will scare it, they will always scare that all the gastric acidity would be a heart disease. So it is the truth lies between the two. Okay, all the time we need to find out that any discomfort from your umbilicus to your chin can be an heart disease. It is not all the time your left hand has to pain. Okay, this left hand pain has been exaggerated. It really doesn't happen in many of the patients. It happens only in 1% of heart disease patients. So this left hand sweating, any sweating can also happen in any of the pain related symptoms. If I have intense gastritis, pain can cause sweating. So many times this pain, left hand pain and sweating doesn't mean it always means an heart disease. Only important thing is whenever a patient comes with a chest pain, two questions which I always ask is either your pain is localized or whether your pain is what type of pain is it. Okay, if your pain is localized, if the patient is able to say that he is able to point with your finger to a chest point, okay, so somewhere in the region of your chest, it means it's not an heart disease. You cannot, heart disease can never be a single pinpoint pain. Okay, it can only be a diffuse pain. So somebody says if we can localize it with the fingertip, it means it's not a heart disease. Okay, second thing is pricking type of pain, that is like something like a a safety pin pricking kind of pain, that is not a heart disease. Only these two quality means that it is not a heart disease at all. All the other variety, anything, if it can be a compressing pain, it can be a burning type of pain, whatever it is. Usually chest burn is attributed to acidity. Okay, it is not like that. Okay, so any pain, okay, except the localized pain or the pricking pain, need not be the heart pain. Okay, but all other pain can be a heart related pain here. Okay, so basically, so pain can be a cause of heart disease. Okay, central chest pain, mostly this heaviness and left sided chest pain will always be most likely to be an heart disease. Any pain, if you get over the chest region, you should always take an ECG. Okay, let it be gastritis. You can, 1,000 gastritis can be escaped. It's like 1,000 innocent people can escape out of the court, but there cannot be one convict which should be escaped. It's the same way. So any chest pain should always be thought it is a heart disease and ECG to be taken. It should not be taken lightly at any point of time. So basically, central chest pain, heaviness, classically while walking or running or doing some exertion, all those things means, or climbing stairs, it means it might be an heart disease pain. Second thing is breathlessness. Breathlessness can be due to two systems. That is, it can be heart, it can be lungs. But if it is due to lungs, it should be associated with cough or breathing. What do you call? Even at rest, there can be breathlessness. But when it is with exertion, it is always means that is during work. It always means it's a heart disease. So then would be giddiness. Sometimes vomiting and belching can also be a sign of heart disease, especially in elderly people. That is, elderly people, they will not give you and diabetic people, they will not give you a classical chest pain. Many times in diabetic and elderly people, they will have nerve related issues, so they will not be able to perceive the pain. So for them it will be excessive fatigue. Just tiredness can also be in heart attack in that kind of scenarios. So elderly people, diabetic patients, you will not get a classical symptom. So any pain from your chin to your umbilicus, you always need to think it might be heart related pain. So what increases the risk? This is something which we need to know. So basically, when you age, okay, your heart disease component risk increases. So when you age, your gender, okay, males are more prone for developing heart disease than the females. Usually till menopause, okay, females are slightly protected. Okay, after menopause, the men and female ratios for heart disease almost becomes equal. So, but this is not the same in as it was in 10 years before. Basically, now females also have the same habits like what do you call men. Okay, basically in metros at least people smoke. Okay, people do drugs. Okay, yesterday I had a 19-year-old person who was doing drugs here. That is what I was telling yesterday. So basically the habits are closed down. So the advantage with which women has till menopause has slightly been decreasing with years now. Okay, because alcohol intake and also what you call smoking are almost catching up also with women. So that the difference between males and women having heart disease is also coming down a little bit. So sex and race. Okay, being a Indian, okay, we all belong. We all when you compare it to the Western population, our heart disease risk is slightly higher. Mainly because there is some genetic disposition, something like the chromosome 9 has got in Indians a disposition to develop an heart disease. So the race is important, and family history. Anybody in your family who has heart disease less than 60 years of age, not more than 60 years of age. Anybody who has less than 60 years of age, genetically we are also prone to have a heart disease. So these are the parameters which are the risk factors for heart disease, but we cannot do anything about it because we cannot prevent aging, we cannot choose our gender, we cannot choose which country we are born, and we cannot choose which parents we are getting to get born. So what are the things which we can prevent is, these are the things. That is, what you can prevent would be your high cholesterol, smoking, high blood pressure, diabetes, alcohol, and physical inactivity. And more importantly, which is very important, is a good sleep. Okay, which I'll get it later a little bit. Okay, so basically, there are things which can be prevented. Okay, to which can be modified to prevent heart disease. These are something which are present here. This can be prevented, but on the other hand, your race, your genetic predisposition, or your gender cannot be changed to prevent an heart disease. So how do you prevent it? So diagnosis, as I told earlier, many times, okay, we do ECG, echo, TMT, angio to find out whether there is an heart disease. But only single important point which I need to say is, just a simple one ECG sometimes may be normal in a heart disease patient. Okay, always when you take an ECG, take a Xerox of it and keep it. Always you need to compare with your previous ECG, and the ECG paper is a wax paper. Okay, when you keep it for a longer time, it will always get faded out. So whenever you take an ECG, you need to take it and either photocopy it or take a picture in your phone and keep it. So this ECG sometimes during an acute onset chest pain, that is when you have a chest pain, okay, that initially 10% of the time within 3 hours it might be normal. So all the time when you go with the chest pain to a doctor, make sure that he takes an ECG, and the next step what you do is you repeat an ECG after half an hour. Okay, when you do repeat ECGs and then serial ECGs are found to be normal, then you can move out of the hospital. Rather than there have been instances when you take a first ECG to be normal, and then the patient goes to home and dies, drops down dead. Okay, so ECG need not be all the time, okay, abnormal. And second thing is, there are multiple blood tests and also treadmill tests There are something called as myocardial perfusion test, angiogram, CT angiogram. All these things are something like a cumulative thing to find out whether you got an heart disease or not. Just because my ECG is normal doesn't mean, or my echo is normal doesn't mean I don't have an heart disease. It is depends on the risk factors, how much you want to evaluate. Okay, so how to keep my heart healthy. This is something we come to the last session, that is the last part of my discussion, which is more important or more pertinent here is how to keep my heart healthy. Okay, so this is what a doctor would always say, okay, or a YouTube doctor will always say: avoid smoking, okay, be physically active every day, keep a healthy weight, keep your blood pressure healthy, keep your blood sugar healthy, and eat a heart healthy diet. Okay, this much they will speak. Okay, but this is similar to something what we listen to sermon. Okay, when we go to a Sunday mass. Okay, when we listen to sermon, I don't think many people will follow it. Okay, so what we will always do is, okay, we'll divide it and think about it in a practical way. Okay, how do you do it is smoking. Okay, there are some young people sitting here. Okay, I don't think this is important for this crowd. Okay, but still, when you smoke, okay, one puff, okay, makes that you lose almost 7 seconds of your life. Not one cigarette. Okay, one puff is going to lose 7 seconds of your life, provided you don't develop a lung cancer, provided you don't develop any cancer related illness. Okay, so when I told this to my patient once, okay, he is like he's a chronic smoker, chain smoker. I told him that one puff is going to cost you seven. He was not. He was angioplasty was done for him. Stent was kept for him, but still he was smoking. So I told him that still he was healthy. That's why he was always saying that he continues to smoke. I told him that you are going to lose one puff. But the next time, when after 3 or 4 months when he came, he made a calculation. Okay, that is, he was around 58 years of age, I think so. He made a calculation that he is going to smoke around 12 cigarettes per day. So one puff in a say number of puffs in a cigarette is going to be 10 puff. So he calculated 10 into 7 is going to be 70 seconds. So 12 cigarettes per day. So he made some calculation and told me that he's going to lose only 2 years of life. That is, he's going to die at 65 means he's going to die at only 63 years of age. So he wants to live his life king, just like king, smoking rather than decreasing his smoking. So then I told him one thing. Okay, நீங்க வேணா கிங்கா வாழ்ந்துங்க. Okay, but the second thing what you need to do is the passive smoking. Okay, passive smoking, that is your children or your wife who doesn't smoke, okay, is going to lose 3 seconds of their life. Just because you are going to lose 7 seconds doesn't mean, okay, it doesn't mean all the time you don't get lung cancer. Okay, he always makes a calculation like that and comes like that way. But still, passive smoking is going to cost 3 seconds life loss of life for your near ones. So second hand smoke is going to cost 3 seconds life. So third important is, when you look at the statistics, this heart attack and heart disease is slightly more in metro cities, not in your what do you call villages or something. The highest heart attack happens in I think BG. Okay, so second highest heart attack happens in Delhi. Okay, so these are all highly polluted cities. Okay, that is the reason why this hydrocarbons inhalation, basically it is also a smoke. Okay, you inhale those kind of things, you develop respiratory disease and also heart disease. But the pollution is not exactly under our control, but smoking is exactly under our control. So you can always stop smoking. So second thing is sugar control. Okay, many of our heart disease patients will have diabetes. Okay, so controlling the sugar will prevent you from multiple complications of diabetes. Once you have diabetes, it always means that you also have heart disease. It is a dictum that once you are diabetic, you have heart disease. So that is the reason why many patients who have diabetes are also prescribed anti-cholesterol tablets. Okay, not because they have cholesterol, mainly because this cholesterol is going to prevent them from developing all those coronary artery disease. So that is the reason why diabetic patients should also get cholesterol tablets irrespective of their cholesterol medications. So that is the reason why medicines are to be prescribed for them for all diabetes. And weight reduction. Okay, the more and more heavier you become, the more and more the heart becomes. Heart should be of size of something like just like your fist. Okay, when you close your fist, that is your size of your heart. Okay, so when if an obese patient, if your body is heavy, okay, even if you close your fist, that is will be the size of your heart. So that heart will be struggling to pump blood to that body mass. Okay, so when the heart struggles, what really happens? Heart rate increases. When the heart rate increases, there will be more blood flow through their blood vessels. The more the blood flow, cholesterol will get deposited in your blood vessels. So basically, really happens is the weight, ideal weight should be maintained for everybody. Okay, so to prevent heart disease, how do you maintain the ideal body weight? That we'll discuss later. That is by either by diet or by exercise. Okay, so next step would be BP control the same way, not as equal as diabetes, but blood pressure control is also as important as your diabetes to prevent heart disease. So basically, BP is something like heart is pumping against the BP. So BP is a resistance against which heart is pumping. So if your BP is on the higher side, on the opposite, so it is like similar to your what do you call going to a gym and lifting a weight. If you're lifting 20 kilos, you will put this much of biceps. Okay, if you lift 25 kilos, you will put this much of biceps. So basically, heart is also a muscle which is going to pump against the BP. So the larger the BP or higher the BP on the other side, your heart is going to struggle against it, and your heart is going to get heavier and heavier. So its muscle mass is going to build. Once the muscle mass is going to build, the blood supply is not going to be adequate for that muscle mass. Once the blood supply is not going to be adequate for the muscle mass, it will develop this cholesterol deposition, and you will develop an heart disease. So ideal body weight is also important. Ideal BP is important. Weight reduction is also important for achieving a BP control, and exercise and salt restriction. How do you do exercise? How much you restrict salt? We'll discuss later. So, and more important is this is something which I always tell my patients: heart healthy diet. Whenever a patient comes to me, they will always ask me about what is the food they need to take. Okay, so this is something I always jokingly say to them. நான் டாக்டரா ஹோட்டலில் வேலை செய்கிற வெயிட்டரா அப்படின்னு கேட்பேன். ஓகே, ஸோ மெயின்லி பிகாஸ் ஆஃப் ஒன்லி ஒன் திங், பிகாஸ் this the difference between a food, okay, from Kanyakumari to Jammu Kashmir, okay, it varies. Okay, you cannot have a particular food which is good for the heart. It is not like that. Okay, so people say keep 2 badams, 2 pomegranate, that is good for the heart. It really doesn't work like that. There has not been a study which says that, okay, even that slogan, an apple a day keeps the doctor away, even that is not proven. Okay, that people say you need to eat fruit, that's it. It doesn't mean that how much of fruit you need to eat, how much of what you call badam you need to eat, how much of pomegranate you need to eat to prevent heart disease. Nobody has done a study about it. So it is just a good habit they just try to proclaim. So it is not always about what type of food you eat. Okay, there is sometimes the type of food is also important, but more important is the calories which you take, and how much you burn out. Okay, that is more important. Okay, basically I always tell them, some of my patients, there has been a patient who keeps taking everyday beef, okay, and still his stent is very good for last 10 years. And there has been a patient who only eats vegetarian, and he has got an heart attack at 35 years of age. So 10 வச்சு 30 வயசுல சுத்தணும் இருக்கிறான். Okay, இஷ்டத்துக்கு சாப்பிட்டு 100 வயசு வரைக்கும் வாழ்ந்தவனும் இருக்கலாம். So it is always a balance. Okay, basically what we eat, okay, should be burnt out. It should not stay in your body. That is the concept which we need to follow. But there are few things which we need to avoid. This is what we say that heart healthy diet. Okay, that is avoid bread, pastas, crackers, potatoes, basically packaged items. Okay, processed foods, and whenever you use oil, try to use something called as polyunsaturated fatty acids. That is, it is always present in sunflower, rice bran or groundnut oil. Okay, many people say olive oil is good for the heart. It is definitely good for the heart, but still, if you cook in olive oil, I don't think you will get the taste of it. I think olive oil has been used in the Mediterranean. I think still the Jewish community will still use. I think Jesus would have cooked in olive oil. I think so. So, but still, olive oil I don't think is good for our community, because 1 liter of olive oil is going to cost us around 1,500 rupees. I think so. So cooking in olive oil is good, but if it is not affordable or it is not palatable, people will not continue to have that. Okay, so that is the reason why sunflower, rice bran and groundnut oil are better than many of the other oil. So fruits and vegetables, this is something which is very good. Fruits and vegetables will have many of the antioxidants. So any one of your meals should be just consisting of fruits and vegetables. Okay, so out of three meals which you take, okay, one meal should be either fruits or vegetables. Okay, it can either be afternoon or night. Night is always better. Okay, because once you get up from morning is the time when you need to eat heavily. That as time goes, you need to you need to decrease your calories. So basically, it is like that. But I advise it, but I don't follow it. But because my night dinner is heavier, because that is the only time I eat properly. So it doesn't mean that it need to be followed, but all the time, usually people work like that. They start in the morning, end up at night. So when you start, your meal should be slightly heavier. Okay, when you lie down, okay, when you go to sleep, okay, your meal should be lighter. So basically, fruits and vegetables, I would recommend it to do it in the afternoon. And when it comes to diabetes, okay, it is always about diabetes. Fruits to be avoided would be all those what do you call, mangoes, papayas, what do you call, bananas, and also jackfruit. Okay, and also sapota. Okay, all these things should be avoided. Usually, fruits should not be taken as juices because it will increase your blood sugar rapidly. It should be taken as a whole fruit. So that is one thing which you need to do, and avoid food after 10 p.m. That is how the usually the earlier you eat, the better it is. Okay, if you eat at 7 o'clock or 8 o'clock, it is always better. But many times when I say to my patients, they always find at mid time they will feel a little hungry. So I always tell them the better fruit to quench your or what do you call decrease your hunger would be guava fruit, not fruit, the guava unripe one. Okay, that is guava kai. Okay, that's all the time better because it has the least calories among all the fruits. Okay, not the ripe one. Okay, the unripe one, okay, has the least calories, and you can take as much as possible. Okay, and it will also give a good satiety, that is decrease your hunger there. So basically this is how you use. And more important, how much will we take? Okay, we know that we need to avoid the bakery foods, we need to avoid the processed foods, we need to avoid fried items. But how much calories should I take? Okay, that is why we know that food is not money. Okay, the next day we can even store our money, but we need not store our food. By God's grace, we always have our dinner ready. Okay, by God's grace, we'll have the next day food also ready. So all the time, we need not stash the food in our tummy. So basically, this is something which was done in Jikmar. Okay, so one of our students who did this, basically he calculated according to the usual South Indian dishes. That is, every person has to eat closer to 12 to 18 idlis per day. Okay, if he is a heavy laborer, okay, there is a person who works in something like what agricultural worker or a person who works as a farmer, that person has to eat closer to 18 idlis per day. Okay, but on the other hand, who does bench job or a computer related work, that person has to eat quite closer to 12 idlis. Okay, so but we cannot eat 3 times idlis, isn't it? Okay, so basically he made some chart like this, whereas 3 idlis is equal to how much of the quantity here. Okay, so basically you can take a photo of this. So one thing which we need to know here is 3 idlis is equal to one puppet, that is appalam. Okay, one appalam is equal to 3 idlis. So out of 12 idlis, okay, you lose your 3 idlis there. Okay, so if you eat 4 appalams, your day is gone. Okay, so basically, but on the other hand, if you look at it, your 3 idlis is equal to 3 egg white. Okay, so your 3 idlis is equal to one leg piece of chicken and 150 grams of chicken. Okay, so this is something which we need to remember, and 3 idlis is equal to one dosa. Okay, so this is just a rough estimate of how much we need to eat. Nowadays we have smartphones where we have apps to calculate our calories. Basically, we can keep our plate and use the app to find out how much calories we need to take. It should be closer from 1200 to 2800. Okay, the person who works heavier, you will have to go up to 2800. The person who works moderate quantity will be between them, but the person who only sits and does only bench work will only have to use only 1200 calories per day. So basically, we all fall might be in the moderate level. So that is the reason why our calories should be between the 12 and 18 idlis. So basically use the Italy count so that we need to know how much. So and one more thing which happens is, if you look at this, your 3 idlis is equal to 1.5 tumbler of milk. Okay. So this is something like, when you people will keep drinking tea and coffee in the middle. If you look at many of our people, they'll always keep drinking a tumbler of coffee or something. So basically, when you eat tumbler of coffee or milk, so it adds on to your calories. So one tumbler of coffee might be equal to your 3 idlis. Okay, so intermediate coffees and intermediate tea and beverages should be avoided, and definitely all the soft drinks has not been calculated here, but still, okay, it will also contribute to your increase. So this has to be kept in mind, because to maintain your ideal weight, okay, your calorie intake should be less than the amount we spend every day. So expenditure should be slightly more if you want to lose weight, okay, and your intake should be lesser. So basically, this is what you need to know. So how do you expand more? How do you spend more? It is by, we need not get something like a body of a movie star, but what we need to know is, we need to remain what you call fit for our weight. Okay, fit for our height. Okay, our weight should be appropriate. So basically, it is like, if my height is 183 centimeters, you minus your 100. Okay, my 100 from this, so I can be up to 83 kilograms, or 83 plus or minus 5 kilograms. Okay, that should be my appropriate height. So many of our Indian females would be around 155, 160, 165. So most of their appropriate weight would be around 60, 65 kilograms. On the other hand, males can vary differently. So it should be plus or minus 5. So basically, that is the appropriate weight to prevent heart diseases. So second thing is exercise daily. Okay, when you exercise daily, what really happens? You burn off some calories, but many times when you exercise more, you tend to become hungry. Okay, and one important thing which how do you decrease calorie is, one practical way is, whenever you feel as hungry, okay, try to drink water. Okay, many a time your thirst is perceived as hunger. Okay, so when you drink water, and when you sit for your dinner or for your breakfast, you will tend to decrease 15% of your calories. Okay, so every time when you feel hungry, always try to drink water and see, okay, whether your hunger comes down or not, because brain doesn't differentiate between hunger and also thirst. Okay, it gives the same kind of stimulus for you. So when you drink water, and if your hunger doesn't come down, that is the time when you go and eat. Okay, rather than that is also a good habit. We need not all the time eat 3 times in a day. Okay, that is the thing. While this intermittent fasting has come into play, it has a big role. Many people are going into that intermittent fasting thing. It helps, but we need not follow it rigorously. Basically, when you feel hungry, drink water and see whether you are able to quench it. If you are not able to quench it, then your body requires some calories. So that is how it is better to eat there. So basically, and when you walk for exercise, the best exercise is swimming, but many of us will not know swimming. So second thing is doing a brisk walking. Okay, so brisk walking in the sense, moving all your 4 limbs briskly and walking. Okay, I'm from Pondicherry, basically, from a seashore. I see people walking, okay, every day, evening. So basically, they'll take a dog and walk. Okay, the way they stroll, it is not a walking for them, it is the walking for the dog. Okay, so basically, it is like you need to walk faster, so that your nape of the neck, okay, and the கழுத்தோட பின் மண்டை, okay, that has to sweat. Okay, only if it sweats, because the nerve supply for your this back of the neck is almost equal to your heart. So when you sweat here and try to continue walking for next 5 minutes, you are given good exercise to your heart. So basically, sweat here and then walk. So it differs from different people. Okay, some people will sweat even 20 minutes. In winter season, they might sweat less. In summer season, they might sweat more. So it all depends on that. The quantity of exercise or brisk walking will depend on how much you sweat, not the sweating in the axilla. Okay, sweating in the axilla is because of hairs and sweat glands. So basically, it is this sweating which happens in the nape of the neck. Okay, that is one thing. And when to walk, morning is the best time. Okay, but it really doesn't matter. Okay, evening also you could do. Basically, you need to do at least 20 to 30 minutes of walking every day. Okay, and adequate exercise. That is what I said. Okay, so 20 to 30 minutes sweating here, and then walk 30 minutes more. You are given a good exercise to your heart. The next important thing is sleeping. Okay, many of our problems which happens during daytime, okay, is related to our sleep. So many of us, while what you call, when you get older and older, our sleep comes down. Okay, the quantity and the quality of sleep comes down. Okay, so basically, if now sister is sleeping there, is the way she sleeps is, it is like a what my grandmother used to say, kaka tukum, they say that. Okay, so basically that kind of sleep keeps on happening. It is not a good quality and a good quantity of sleep. Okay, basically when you sleep, you need to sleep continuously for 7 to 8 hours in a day. Okay, usually by nature your sleep comes down. Okay, a baby which is born will sleep for 20 hours, but the age, what you call, my grandmother used to always say, கடவுள்கிட்ட இருந்து வரும்போது அதிகமா தூங்குவேன், போகும்போது தூங்க மாட்டேன் அப்படின்வாங்க. So that is how it is. Okay, all the time. Okay, so that is nature. But on the other hand, the quality of sleep also matters. Okay, the quality of sleep in the sense, unhindered, non-snoring sleep. Okay, that means there should not be snoring. Okay, snoring in the sense, many people will know that snoring happens mainly because of your tongue goes and blocks your airway. Okay, that is the main important reason of snoring. Okay, so if that happens, what happens? Your oxygen doesn't go. Okay, so people, when you listen to them snoring, they'll always say they'll snore high, suddenly stop, catch breath, and then stop snoring. Okay, what does it really mean at that point of time is, okay, when you snore, okay, your tongue goes and blocks the airway, your oxygen doesn't go to your lungs, and your oxygen doesn't, it stimulates your lungs. So what the lungs says is to the brain will be, oxygen வரமாடுது, சாவ போற அப்படினோட, suddenly the people will wake up. Okay, so basically it is like that. So the snoring is a part where we need to be very, very careful. It is a pandemic. Many of us snore. Okay, it is not about the age. Okay, even my kid at 8th standard snores. Okay, but this snoring, when it is abnormal or very pathological, how can you find out is by doing a sleep study. Okay, if that sleep study says that your oxygen level is very much going down, you are prone for having 10 times more risk heart disease than anybody who has a good sleep. Okay, so snoring, good sleep, 7 to 8 hours sleep is more important. Second thing is yoga and meditation. I don't think I can talk about it because I don't do any of those things. So, but it is good. It prevents the heart disease. Basically, here it means that going to church, praying is also sort of yoga and meditation. That is how I don't think we should go to Sadhguru and do a yoga and meditation there. Okay, so so important to prevent for younger people is, from 20 years of age, you need to do a cholesterol early. Okay, annual cholesterol checkup is mandatory for people who are more than 20 years of age. Second thing is, after 40 years of age, BP, sugar, lipid profile, and ECG should be taken every year. Okay, so on the ECG should be photoed and kept. Okay, echo is an optional thing, not really required. So the practical tips for the heart is, visit the cardiology ward. Okay, so when you visit the cardiology ward, out of all the patients, okay, this heart patients will always live with a scare. Okay, they will always know, they do not know something might happen to them any point of time, because they would have been better the last day. Okay, suddenly they will develop heart attack. So they know that risk will be always there with them. Okay, so when you visit a cardiology ward, talk to a heart patient, you will always find that they live in a bit of scare. So we should not get into those kind of trouble. So fix your height, weight. Okay, height in centimeter minus 100, and fix your calorie. That is 1200 to 2800. 1800 will be that moderate one. Average your daily intake, know what you eat and how much you eat, and fix your habits and do a regular screening. That's the thing. So coming to my first slide, how many ladies do you see? So that is what they say, that all that glitters is not gold. Okay, so that is why I keep saying to many people that whenever people talk about prevention, people talk about philanthropy, okay, I always have a skeptical thing about them, okay, because not all people want people to be happy, okay. If a Kavery hospital or an Apollo hospital, for anybody, for any reason, okay, they talk about it, it will always be a promotional activity, okay, it will always be a promotional activity, okay. So whatever you listen in a social media, it is always a promotion, okay. So a person who does promotion will not speak the truth, okay. It will be partial truth and partially there will be a lie, okay. So here, this is what we need to know. Heart disease is often avoidable, okay. I would always like to treat only the unpreventable heart disease and not the preventable heart disease. So whenever you reach an hospital, this is something which I always say to my patients and my community people all the time. You should ask these questions, okay. In the hospital for now, these questions are mandatory, okay. Because you should always ask, because I find many of the patients being, okay, treated badly or mistreated or misinformed. You should always ask a doctor about what is my probable diagnosis, what is the next set of investigation and course of action, or my medication based on evidence or probability. நீ யோசிச்சு கெஸ்ல எழுதுறியா அல்லது எவிடன்ஸ் பேஸ்டா எழுதுறியா? This question has to be asked. And what is the risk if you are guessing it? Many times you will not be able to find out, okay. Doctor will know there are 1,000 diseases, the doctor will know only 500 diseases, but none of the doctors says I would not know the other 500 diseases. They will not speak the truth, and the 500 தெரியலன்னு சொல்லிட்டு people will not come to him, okay. So all the time you should always ask whether these questions are to be asked, okay, for any doctor, okay. And when you're writing on a guess, what is the risk benefit ratio? நீ guess பண்றதுனால அதுல risk benefit எவ்வளவு இருக்கும்? So these questions have to be asked for every hospital when we meet. This I always used to communicate to with whatever talk I do. So thank you, thanks for your patient listening.